Well, welcome to Talking HealthTech, everyone. Today, we are thrilled to have Chris Smeed, CEO and co-founder of Cubiko, joining us today on the podcast. Welcome, Chris.
Hello. So exciting to be back. Always love these catch-ups / check-ins / what's going on in this crazy world sessions that we get to do.
Love it. So Cubiko is a practice intelligence platform that aims to really improve the way medical practices, I guess, are not only managing their data, but helping them gain insights, increase billings, and make those evidence-based decisions. So we're going to dive a little into Cubiko's journey, your innovative approach to kind of healthcare analytics, a bit about your new CPD feature, as well as kind of your expansion into the dental sector. So, Chris, let's get going. Let's start us off by working us through Cubiko's journey over the last couple of years. What made you start the business? And I guess how has it changed since you started?
Yeah, oh, look, it's a pretty crazy story. So I was actually a practice manager up here in Brizzy, and, living what we try and solve for our customers every day, which is getting better access to our data and then working out a great way to use it. So I was in my little office as a practice manager building dashboards and visiting other practices, and they were like, "Oi, Chris, we hear you got awesome dashboards. Can you hook us up with your dashboards?" And I felt like the worst black market data dashboard dealer in Brisbane because I'm not a good dashboard data dealer. So we knew we had a demand for a product to help sort of general practice get their head around the business side of being sustainable practice. There was great products out there doing clinical data insights, but not a lot doing anything around the business of primary care. So eventually we got together and made Cubiko, and we actually have our 5th birthday in 2 weeks' time. So it's been pretty crazy in 5 years to go from sort of an idea I had as a practice manager in my spare time in an office up here in Brizzy to a company now working with 2,000 general practices all around the country and getting to nerd out about data every day. I am so lucky to just be able to bring those amazing insights. And then some awesome practice management systems have joined us along the way because, data, we couldn't do a data product without getting data from somewhere. So we're really lucky to work with Best Practice. They've been a huge supporter of us. Work with Medical Director. And we recently launched our integration to ZMed. So you have those 3 big primary care PMSs that they're going to get some data to do amazing insights on.
Incredible. You've got the market wrapped up, I see. So I guess I want to talk a little bit about those insights. I guess you had this MVP for a product. How over the years has your kind of direct feedback from general practice shaped the platform since you launched it?
Oh, massively. I was actually the other week looking at Cubiko beta version 1 and just thinking about, it's changed so much. And I can tell you our third beta customer went out to see them at their practice. And I sat with the GP for 2 hours. And I just always remember that being the moment of going, everyone uses their practice management system so differently. And while you think you could be a great data analyst and produce insights, it was the first 100 practices we reconciled by hand with the practice because everyone used the practice management system differently. Everyone had a different way of marking things or recording things or billing things or closing off appointment books or all those weird and wonderful things that we had to work with those practices to make sure we're getting the right answer. So initially, I'd say it was just making sure that we were always getting the right answer. And then just listening to our customers and saying, what insights do you need? What insights do you need? Because I'd say the business of general practice is so different all around the country. And so what's really useful to one practice will mean nothing to another practice. So we quickly grew to having over 1,000 metrics in our product. But I'll hand on heart say that they're not all useful for everyone. Yeah. If you're a skin clinic focusing on X versus a general practice doing a lot of chronic disease management, versus running a specialty practice, versus a bulk billing versus a mixed billing practice, you're always looking at different things. So that's been a really interesting learning along the way. So I'd say the first 2 or 3 years were about expanding the product and making sure we had the right data points to answer the questions that existed in practice. So you can answer the questions, but then pairing that with insights that help you use the data to achieve something. So, look at an example I've used a bit, but, your chronic disease management is lower than other similar practices. It's great we tell you that, but actually we need to pair it with metrics and data insights to help you get the most out of your data and actually do something with it. So that was sort of, I guess, the first 3 years. And the last 2 years have been really focusing on how we build a platform that lets a practice actually narrow in on what's important. So one of the big things we launched in the last 12 months was the ability to build your own custom dashboards and then share that with your team members. Because as a practice, you might decide this month we're focusing on our over 75 health assessments. We're focusing on our over 75 population. So you can now build a dashboard just about that. Share it with your team so everyone's focusing in on 2-3 key metrics. But we also built the ability to then share the layout and the configuration of that dashboard with other practices. So actually have this awesome community now of people sharing dashboards. And when you share the link, it opens with that practice's data. So it's amazing that people can build stuff and share stuff and get those insights and design ways of doing it and then share it around. And then when that person opens it with their version of Cubiko, they see their data in it and they might change something or add something or remove something and share it with their nurse. And then that nurse might share it with another practice and that opens with that practice's data. It's been so cool to see this like chain of dashboards start to populate all around the country.
Wow, that's incredible. What a cool feature. I guess that solves the problem of that awful data dashboards. I'm sure you're working in some clunky program back in the back day. It makes it a lot easier. I guess more recently, as you've grown Cubiko, what are some new guest trends, demands you're seeing from not only practices, but I guess the wider healthcare industry? What are they wanting from a platform like Cubiko? And I guess where's the product going to help assist that?
That's an awesome question. I think what we've definitely seen is a real focus on the sustainability in primary care. You know, margins have been so tight for so long, and with freezes and in indexation really squeezed general practice. So what we've noticed is that a lot of our practices will engage with us because they're looking to be more sustainable and they want to be a better practice, which is amazing. They'll get a handle on what's happening in their practice, but then really want to use data to improve the practice and make it more sustainable. And look, more sustainable definitely should be paired with better patient outcomes. They need to go together, you know, to make a great place to work and a great place for our patients. So for us, we've really seen a focus around how do we use our data for that continuous quality improvement? How do we use it to make a better practice, but how do we use it to also make a more sustainable practice? What else we're seeing is we're seeing the real unsiloing of data. So when I worked in general practice as a practice manager, I was kind of the only one who could run reports. I was the only one with a license of our data software to be able to, produce the reports or the graphs. And then when I went away, everything kind of stopped. So what we've noticed is that we let practices create unlimited viewers, and they can control down to the page, like the sets of pages that those viewers can see. So you can make an account for each one of your nurses to log in, and they can just see pages in Cubiko around quality improvement. Or you can make pages for your receptionist to log in, and they can just see metrics about just what's happening today with just 3 or 4 clicks. Or you can make pages for your independent people around you who are helping you make a better practice to log in and just see financial metrics. So we're sort of really seeing that opening up of data. The right data for the right people is really powerful, but it also stops that sort of one person being the cog in the wheel, and if it's not there, it all stops spinning. The other thing we've seen is a really, really big uptake of our My Cubiko products. That's individual data of that doctor just on them. So when they log into Cubiko, they only see their own data. And we've seen thousands of GPs start using that all around the country. It's kind of like a highlights of Cubiko, but what is only relevant to an individual practitioner, which is amazing to see that engagement. And we really sort of target different patients in that cohort too that doctor can engage with. So definitely delivering the right data to the right people so they can use it. The other big thing we've noticed is that we have a product called Touchstone, which is an opt-in, de-identified, aggregated data set that has over 800 practices that have chosen to opt in to be part of that. And it's de-identified, aggregated, and a whole lot of amazing data magic around it. But when you opt in to be part of that, you then get to see your practice data versus a whole lot of national averages and state averages or different filters to look at it. And what that means is it gives amazing context to the data. So in my practice, I had a no-show rate. I didn't know whether that was a good no-show rate or a bad no-show rate. It just was like, what could I reach out to? I didn't know whether my wait time was good. I didn't know whether my billings were what other practices were doing. And I was running a bulk billing practice, but when I Googled, general practice benchmarks, there was just a whole lot of stuff around national averages. But comparing my bulk billing practice to a mixed billing inner city practice, they're very different businesses. So having those context-aware averages and benchmarks has been really powerful as well. So definitely the contextualization of data has become really important.
Wow, that's quite incredible. I actually can't believe that didn't exist before, to know how your practice is doing in the context of other practices. Incredible. So it sounds like Cubiko's journey has been really data focused. I hear you're launching a CPD module or branching out into that space. Why tackle CPD? Can you talk us a little bit about the product expansion into that area?
Yeah. Look, it was a really natural progression for us. We launched quality improvement in Cubiko for the practice about 12 months ago. So every year, all our customers can get together. Have you heard of Comic-Con or Xerocon?
Yes.
We do Cubicon every year on our birthday.
Nice.
And so this year, we've got 500 practices coming just to nerd out about data. So last year at Cubicon, we launched quality improvement for the practice. So you can do that quality improvement cycle. And one of the biggest bits of feedback, and to your question earlier on about is what guides us, it's that feedback from our customers. And the feedback was, we want to help our GPs, our doctors working in our practice, our practitioners who are using our practice, complete their CPD as well, which is very similar quality improvement. So we've built a whole lot of stuff in partnership with some great guidance from the RACGP on measuring outcomes. Because measuring outcomes is something that your data can really help you focus in on. Like looking at it and saying, where in my practice using my data would a measuring outcomes cycle be useful? And then implementing that. And the really cool thing is when you can align that with what the practice is doing or vice versa, the whole community within a practice is working towards a similar goal. And, community is a big reason that a lot of people get into general practice, because they want to be part of a practice community. They want to look after their wider community. So aligning CPD with that community goal has been really, really useful. We also knew we could make it a heap simpler. Just doing it all in one spot, the times and the hours getting logged back to the college just made it a lot easier. So it's been an amazing journey to go on, and we've got some awesome innovation that's going to make My Cubiko really, really useful for individual doctors to complete their My CPD, their individual outcomes.
Incredible. So are you actually using practice data to inform areas of CPD that a particular clinician might want to work on? Is that kind of how it works?
That's it, totally. So you can jump into My Cubiko, and you'll see all the different modules, and we're building more and more CPD activities as we go. And you'll sort of see where you're at. And, it's not meant to be a good or a bad thing, but it's saying, look, you might have 100, and these are just totally silly made up examples. You might have 100% smoking status recorded, but only 20% alcohol status recorded. Like, these are just picking trivial examples here. But as a benefit for your patients, would doing and measuring outcomes around the one you have 100% on be as useful as doing the one you had 20%? No. So you'll pick the 20% one. And that'll have a meaningful impact on what's happening in your practice. So we're doing that across a range of clinical and business metrics, because I think that's really important to have that balance in what you're doing in your practice. But yeah, you're right. Choosing areas that will move the needle on the population health of your practice and the patients who you're there looking after.
Yeah. Are you going to branch out into nursing CPD? That's a throwaway question.
Nursing CPD is very much involved in what we do as a practice.
As a current registered nurse, my little reflective template. It's a bit useless. I want a platform.
Exactly. We're one company. We only do so many things at a time, but I love it because we build building blocks of tools that we can then combine to do different awesome things with. So we've got some really amazing stuff coming down the CPD pipeline, as I call it, over the next 12 months, just designed to, I guess, two things, like make it easier to complete the CPD. But I think more importantly, making that CPD actually have a real impact on the patients you look after. That's what gets a lot of people at Cubiko out of bed every morning. It's what gets me out of bed every morning. So, when you asked why we got to that idea, it was like, well, this is a great way to actually, benefit patients, but also help our teams as well. Yeah.
Moving it from just a tick box that you complete each year to something that you see actual value in. I definitely see that as the future of CPD. Sounds awesome. Now, you've recently entered dental analytics space. I guess it's a new field for you. Has it been challenging to branch out from that GP medical specialty space into dental? Talk us through that process.
Yeah, so we partnered with the Centaur crew, the Dental for Windows crew, and it's been an amazing co-collaboration to build our dental product called Satora. So it's not called Cubiko, it's called Satora, powered by Cubiko. And it's been amazing to be able to take everything we've learned over the last few years in presenting data, getting data, showing data, all some of those features we spoke about before, and partner it with the crew from Dental for Windows and Centaur with their, many years of insights of working in dental, to put together like an amazing team of people who've been building out our dental product. I think it's pretty easy these days for someone to buy a copy of Power BI or Tableau or Click or something off the shelf and start building their own dashboards. Where we really add value and see the strength is that we actually build dashboards, products, services that are already built to answer the questions that your business needs. So you could spend 3 days building the most amazing appointments dashboard. But what if you use Satora or you use Cubiko? That dashboard's built, and every one of the permeations or the ways you do things or the resilience of the data model we built into it. And so you can use those 3 days to focus on actually doing something in your practice to shift the needle. So that's been the really interesting bit. I've had to learn a lot of new terms as a general practice nerd. Coming into dental has been a bit of a, oh, wow, you call it this or you call it this, so I've got to learn this. And then also actually not having like really an MBS schedule to base a lot of things around really changes things as well. So that's been some big learnings. We've got an amazing product manager at Cubiko who has a dental background. So that's been really good to help us guide it. But yeah, I think one of the best things has been that co-collaboration to build something awesome. And it doesn't stop when you launch it. We still are building new things every day, and we're collaborating every day to flesh out the product. I think the first year after you launch a product is just that, oh, yes, that's awesome. Let's build that. Customers want this. Oh, you can tweak this. Let's make this. So we're in that super cool phase right now of just talking to customers whether we're onboarding or been on board of being like, what do you need to know? How do you want to know it? What filters do you need on that? What makes it useful? What do you need to see that with? How can we use this more useful? Where can you use that in your practice? And the product's going to rapidly grow and expand over the next year. So that's super exciting. And hopefully I just stop using all my general practice words and start using my dental words better, which will make me look less like a fool.
Oh gosh. But I guess why dental? Was there a gap in the market? I feel like sometimes we're a bit left behind in technology. We forget it's such a huge part of healthcare. Is that why you did it? You just saw a gap?
Yeah. So look, we'd built for general practice, and we'd built for specialists, and we looked around, and dental actually made a lot of sense because there's a lot of general practices and dental practices that now co-locate or have similar ownership. There's a lot of similar economic drivers, utilization per appointment, asset utilization, room utilization, reception utilization, looking at opportunities, lots of ways you can use data to improve. So for us to sort of choose where to jump to next, we didn't want to go too far from our core, GP space, and dental made a lot of sense for us to move into. And then we found the awesome crew from Centaur. I think that's one of the things in health tech that sometimes gets a bit missed is actually just a cultural fit to be like, we want to work with you guys. You want to work with us. That actually makes a lot of sense. We could have gone into dental and just been by ourselves. We made a product that was not as good, but also didn't tick what the market needed. So it really felt like right time, right place, right partners, right internal energy. Like our team were really pumped to do dental. And that was really important to me that we go where our team, our company's energy was. So that's where it was. And it wasn't happen overnight. It took a long time to get there. But we're super pumped to be in that space now and growing the product.
I guess you've worked in healthcare data and analytics for a long time. I guess kind of zooming out a little bit in your work with both Cubiko and branching out into the dental space. I guess where do you see healthcare at the moment, be that primary care or in dental? What's happening at the practice level? How are clinicians feeling? How are practice managers feeling? I'd just like to know a little bit about that from your experience.
Yeah, look, I'll probably answer that question from a general practice background. More over the dental background. I'm still meeting so many amazing dentists and dental practice managers that I'd hate to be, put the wrong words there. But I think a lot of the challenges are very similar. As I said, Cubiko was a product that was built facing the brutal business realities of running a practice. So I guess I'll probably always answer questions from that lens as well. I think what we've seen is a massive shift to general practice. The decline in bulk billing has seen general practice value their time as what it needs to be valued, and value the sustainability of their business. And I know that sounds a bit brutal, because I also really believe in the need for bulk billing practices, but we need to make sure the models of the businesses that we build can support being sustainable. So I'll give you an example. I spoke to a bulk billing clinic that was looking to move to being private or mixed billing, and they were doing 4 appointments per hour. They did 4 appointments per hour. That's what their business model was. And they did the numbers, and they said, for us to remain viable, we need to move to being 6 appointments per hour to be viable. So the choice was move to mixed billing and stay at 4 per hour, or move to bulk billing and go to 6. And look, I know that the practitioners are individual contractors and you can't force them to do anything, but that was the reality for that practice. So what they did, and what a lot of amazing practices, is actually just sat everyone down and was really open and transparent about this is the reality we live in. And they aligned everyone. Everyone aligned and said, we want to be a 4 patient per hour mixed billing practice, and got on board with it. Other practices had similar conversations and said, great, we're going to move to 5 appointments per hour and be a bulk billing practice, and everyone was on board with it. So I guess to your question about what trends we're seeing, I'm seeing a really promising trend that practices are thinking about how they'll be a sustainable business, but it's not all just being captured by the poor owner who's trying to do a million things. Having a culture and a team behind that business outcome has become super, super important. And you can't sort of have that without some open transparency about what's going on in the business. Other things I've noticed is that post-COVID, and I know a lot of people say this, but I live it every day, people are so much more open to technology and what it can do. I remember when I started Cubiko, people were like, oh, cloud, no, can't do anything in the cloud bad. Like that was a pretty common response. Whereas now it's like, how does the cloud work for me? How do I use it in a safe, responsible way to get the best outcomes? So that's been really good. Sadly, I think we saw a lot of businesses and people race into the sector who hadn't been around for a while, or didn't understand the sector, or didn't understand the intricacies of it, and try and make a quick buck making software out of it. So I think we'll probably see that those sort of operators won't last, because people will ask questions about your security and how you work and why you do things. So I think it's sort of knowing who's there for the right reasons with the right measures. It's just as important, to the values of who you engage with are just as important as your practices focus as well. So you've got to match them up. I'm sorry, a bit sidetracked there, but I definitely see that happening as well. I see definitely a focus on where is the government going to go next and how will we be funded, and some nervousness and angst around that, particularly with the changes coming to chronic disease management in the back half of this year. Changes we just had to the aged care incentive. People, I think, are generally, keen to make a better, more sustainable system, but they want to understand it, and they want to have time to bring their practice teams, but also their patients on the journey as well. So some bit nervousness, I'd say, on that front there.
Chris, it has been so great chatting with you about Cubiko and all the cool stuff you're doing with primary care data. It's exciting to see how you're shaking things up from kind of helping GPs and managing their ongoing CPD training and kind of diving into this new world of dental analytics. I guess before we wrap the episode, do you have any final thoughts or comments you'd like to share with our listeners and community?
I guess, to me, being part of this community for the last 5 years has really helped me make a better product, a better piece of software. I started off as one person. We're now a team of 30 people. And if it wasn't for the community in health tech, I don't know whether we got there as well. There's 2 or 3 people I can think off the top of my head who once a month, once every 2 months, since we started the company, have no commercial gain, but would just call and say, mate, how's it going? It's rough starting a company. It's tough running a business. It's tough working in health tech. How are you? What can we do? What can we help with? And, they had no commercial gain out of it. But I just think that's one of the amazing things that Australian health tech needs to celebrate and make sure we do more of, is actually just how we support each other. Even if there's no commercial endpoint to it, it's actually super important, because we're a small community, but we can really help each other if we get together and just support each other on a human and business level is super important. And I guess my last thought is just a huge thank you to every GP, every nurse, every receptionist, every general practice and specialist and dental team member around the country for everything they do every week. I'm just so lucky to get to nerd out with them about data, but I know what it's like, and I just respect and thanks to everyone.
Well, I think that's a lovely note to end on. Thank you so much for joining us today, Chris. We will leave, obviously, all the important links to Cubiko's work in the show notes. Thank you for listening,
Amazing.
everyone.
Thank you so much. See you later.
Yes. See you next time.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.